University of Health Sciences, Antigua. This university is registered with the WDMS. It is recognized by GMC, ECFMG, MCC, and AMC. It's based in Piccadilly in Antigua, and this university is one of the Northern Hemisphere's foremost universities. It's got extensive contributions to global medical education with alumni from over 21 countries. The university was founded with a focus on comprehensive system of medical education that addresses regional and international challenges in medicine. It's renowned for its emphasis on practical standards, collegiality, and scientific research with diverse cultural training with global transferability.
You know, this we hear about these countries, the Caribbean, and the first thing that kind of comes to everybody's mind, I think everybody just kind of smiles right away. I mean, you know, like Piccadilly, which is the area, the city of where the university is in Antigua. After doing so much research, it's so beautiful. It is just so beautiful. So in a way, it is like a little bit, let's say, because you're not going to study on these islands to just go and have fun, obviously, but it's like studying on the beach.
Yes.
In a way, let's say, in a way, it's like studying on the beach, but of course but it's a beautiful, beautiful atmosphere. So I think it really is.
I've been there,
yeah,
so.
you've been there.
Coming from North America,
Yes,
obviously,
well,
a lot of us
we are-
have the Caribbean islands as our vacation spot.
Yes,
So
yes,
I've been to
yes.
Antigua. It is a beautiful island. I really did enjoy it. And when I speak to students, right, I always tell them this, and I laugh a little bit and tell them, you can just take your laptop and you can just actually do some of your studies underneath a palm tree.
Yeah, exactly.
Which is something that you can't find easily.
No, you can't.
So, yes.
You can't.
It's a very beautiful island.
I think it's an amazing experience for many students.
Yes.
And you know, it's with these direct flights from the UK,
which is perfect.
Perfect.
Takes you there.
I think it's because it's Commonwealth also, so very
Easy for them without having to worry about getting
visas or anything.
or
Yeah, exactly.
worrying about anything, which is really good. But they're just beautiful, beautiful islands. Both of them are. So
Both,
is Barbados.
of course.
But for
Now we're
Antigua, which
talking
is
about
where we're
Antigua.
speaking now,
We're going to be talking about
being there,
Barbados.
vacationing there, it was a beautiful island, and I had a really good time.
And the people very friendly.
Yes.
Very friendly culture. And of course, the UK route.
The UK route, the duration of the course, as we said before, is 4 years, but you can do a 3.2-year course if you would like to do your clinical rotations back to back, which means with no breaks. The curriculum is taught in English and is structured into 4 years of learning. The first 2 years, as we said, basic sciences. That's 70 weeks, which is 5 terms because they have trimesters. And then the last 2 years are clinical rotations. They're 78 weeks and they are comprised of core and electives. The core rotations are 48 weeks out of the 78, and that will include internal medicine, surgery, OBG, pediatrics, family medicine, psychiatry, and then the elective rotations are 30 weeks where the students are allowed to choose what they would like to do. The clinical rotations are completed in the university's affiliate hospitals, which are in Antigua and in Western Canada. And the total number of clock hours, very important for our British students, are 6,345.
So here, GMC requires 5,500. And of course, we have the University of Health and Science in Antigua, which has over 6,000 hours.
And I would like to point out that it's a very good learning experience going to a hospital, even in Canada and with Antigua, because you get to learn different systems. Like,
first of all, to have that experience on your CV, having the experience of working in Canada, to be able to have the experience of doing clinical rotations in Antigua, and then somebody coming back home here in the UK and having that on their CV. I think in general, being able to do clinical rotations in different countries helps the students being able to adjust in the hospitals when they do get back.
And it's a benefit.
Yeah,
it's a very big benefit.
One moment. I think this is getting stuck, you know, having a live open day. Okay.
Bloopers.
Yeah, we're going
Can't
pretty
be
good.
without bloopers.
So here we're going to talk about the exclusive tuition fees that, of course, only SME has for our students. Now, the medical program and the tuition fees that are exclusively offered for SME students are 7,000 pounds per year and paid in 2 installments every year. So you have an exclusive offer where we all know, and I'm sure you are aware of, the very high tuition fees that the universities in Antigua have. So this is an exclusive offer for SME students, and of course, the limited places that are available. So anyone, and I'm sure that we have many students that we have spoken to already who have started their application, who have applied already, and many of them are going into May because we have a May entry also, just like we said before, and then the next entry, of course, is September. So many have secured their place because first and most importantly, they have a program that is meets all the requirements for them to be able to come back and obviously work in the UK and register. But they also wanted a program where they would be able to have the low exclusive tuition fees that only SME students, 7,000 pounds per year, and not having to pay astronomical fees, amounts that can reach up to 100,000. So I think this is an exclusive offer only for SME students.
And I'd just like to add here for the students that would like to do the 5-year program, which is the pre-medical one, very exclusive tuition fee for that online program also at approximately 5,000 pounds for that year.
Yes, correct.
Which is also
yes.
perfect because if you think that it's still an exclusive price compared to what you would be paying
normally,
in a normal,
and
even
they don't have any
universities.
expenses there because
Yes,
Jane, they're online. They're online for 1 year. You don't have to go abroad. You can do your pre-med course and you will be getting your MD degree in 5 years instead of 6.
And in this university, you have the choice to do it even in less than 5 years. You can do it in 4.5 as long as you want to do you're ready for your back-to-back.
Yes.
So someone who's adventurous and is ready to go can do it instead of doing a 6-year course, someone can do this in 4.5 years.
And you know, I have some students saying, why don't I start off with the 3.2 years, 3 years? And if I see it's too much for me, if I see it's too much, it's too intense, then I'll just continue and do the 4-year program. You can also do that. But most importantly, I think we've left out the most important thing, that our students have a guaranteed entry.
Of course.
Guaranteed entry into this program, as long as you meet the qualifications that we said, the requirements, you have a guaranteed entry into this MD program. So here I would like to give some information and present our speakers. Now, we will be talking first with the representatives of University of Health Science of Antigua. Now, our first speaker today with us is Dr. Akande, and he's the president of the university. He served in the public corporate sector for Kellogg's Company brands, holds an MBA in organized leadership and a degree in Doctor of Education from Creighton University, Omaha in the US. We will also have with us Dr. Manuel Flores. He's the provost and vice president of the Academic Affairs Department. Lead team and acquired accreditation. And I think he'll actually be kind of impressed, Dr. Flores, because I really wanted to make sure I know what these abbreviations are. And I hope you are impressed because I did. I'm trying to find it, of course. I think that I have it here and I want to explain to everyone what these are. I will get back to it because I have all the abbreviations of the MSCHE, the LSME, and these are the accreditation centers in the US. And I did a lot of research because I wanted to be very much informed of exactly what these abbreviations are. And of course, the Puerto Rico Council for the Higher Education for San Juan Bautista Medical School, co-leader teams for ACCM and CAMHP and NYSED accreditation. And he has an MD from the Central University of the Caribbean, Bayamon, Puerto Rico. We will have with us Ms. Roman, Vice President for the Institutional Advancement Department, led the process of greatly expanding the university's teaching hospital and network throughout the US, Canada, and in the UK, acts as the liaison between potential educational and financial partners and the university. She has an MBA from the University of Sacred Heart in San Juan, Puerto Rico. And of course, we will have with us the two doctors I mentioned earlier. Dr. Morris, a UK graduate, has 5 years of experience already working in the NHS as a junior doctor. He is currently in his final year of training in Kent, Surrey and Sussex to become a fully qualified GP. He holds a bachelor's from the University of East London, a master's from the University of Kent, and an MD from, of course, the University of Health and Science in Antigua. And of course, Dr. Nair, another graduate, has over 5 years of experience also in the NHS, junior doctor, and has a special interest in sports medicine. Currently is in the final year of training in East England and a fully qualified GP. He holds a bachelor's from London Metropolitan University. We will have all these representatives and these speakers with us today, and it is our pleasure because most of all, it's because we want you to get the information firsthand, directly from the president of the university, the vice presidents, the academic affairs, the students who have studied there, and our doctors back in the UK. And of course, the University of Barbados. Sorry, I'm so sorry. We will be, I'm so sorry. Sorry about that. Do we have Dr. Akande with us?
Hi, good evening. How are you today?
Good evening, good evening.
Good afternoon to you, good evening
Good
to us.
afternoon to you.
Good afternoon from Antigua.
Thank you so much for being here. It is our pleasure to have you here today. And it is very important for our prospective students to be able to get all the information directly from the source, from you firsthand.
Absolutely. The pleasure is ours. So thank you for having us today.
So let's start off with just to tell us a little bit about, briefly to tell us about the program, the life in Antigua, but mostly about the education in the University of Health and Science.
Sure, absolutely. And I mean, would it be okay, or is it appropriate if I could share my screen? Is that all right?
Yes, yes, of course.
Oh, fantastic. That'll just be much better because I do have just a brief little presentation. Should be able to see my screen, I'm hoping.
Yes, we can see it. Yes, of course.
Fantastic. So actually, this is actually an aerial view of our campus in Piccadilly here in Antigua and Barbuda. That's where I'm joining you at this time. And so just to kind of give a little bit of a background about us. So the University of Health Sciences Antigua, we're actually one of the oldest private medical schools in the entire Caribbean. Our university was founded in 1982. And we actually sit on a 50-acre campus in English Harbor area, which is the southern part of the island. And with our serene and safe campus here, we're actually right next to where there's a vibrant area called Nelson's Dockyard and Falmouth Harbor, et cetera, in English Harbor, where a lot of the restaurants and students can enjoy that when they're not studying, for example. And so UHSA was actually when we were the only medical school in Antigua, and the oldest school, and we have graduates practicing in nearly 21 countries, I believe, over that at this time. And so, including the United Kingdom, you'll meet some of our graduates today on today's webinar. And as you accurately explained, we have our MD program, which is conducted here in Antigua. The initial years of the program are dedicated to the basic sciences, which is completed here, and Dr. Flores will expand on that. And then the final years are in our clinical sciences, where students complete their clerkships at our partner hospitals. And you mentioned some of the licensure and recognition of UHSA. And I won't get too far into this here, but just to let you know, our university is recognized by the GMC. We are recognized by the ECFMG. And also, of course, we're listed in the World Directory of Medical Schools. And some additional credentials, we also are recognized by the Medical Council of Canada as well, in addition to other countries, which I haven't listed here. So just to kind of give you a little bit of a background about life in Antigua. So Antigua is just a quick 7-hour flight from the UK, and we actually have flights daily that to Antigua from London Heathrow and London Gatwick Airport through British Airways and Virgin Atlantic. And so Antigua, we are an island of around 90,000 people, and we're actually a member of the Commonwealth. And one thing I always tell people, and I'm proud to say, is that we're actually one of the safest islands in the Caribbean, and probably one of the most developed as well. In Antigua, we have a very, very large UK population here. A lot of other European countries as well, a lot of Italian, but great majority of our expat population are actually from the UK, actually. And in our area, especially particularly in English Harbor, there's, near the campus, we have several grocery stores, which are conveniently located. There's a lot of history on this side of the island with Nelson's Dockyard, etc. And there's just a lot of activities when you're not studying, for example, like hiking trails, and constantly there are different events happening. So for example, in a few weeks time, we'll be having something that's called Antigua Sailing Week. And this is when boats come from all around the world, and they're doing races, and it's a very fun, vibrant community on our side of the island. And I like to say that only because, of course, students are here to study, and our campus is very, very quiet and peaceful to allow for studying. But of course, students like to get out and just for enjoyment, of course. So here on our campus, actually, we have 24/7 campus security for our students. There are, of course, administrative offices. The entire campus has high-speed internet. Some of our facilities include our student library, our simulation labs. There's on-campus accommodations as well. We do have a lot of students who choose to stay on campus, but we also have a lot of students who like to go into the community and rent houses that way. On campus, we also have a restaurant. We have student lounges, anatomy labs. There's a fitness facility here. And we have something called the standardized patient unit, which Dr. Flores will probably expand on that a bit later. And in addition, we also have our free clinic, which is a big initiative that is really dear to our hearts. So the free clinic is a student-managed clinic where our students actually are, of course, overseen by our faculty and local physicians and nurses. But the free clinic allows students to actually interact with members of the community, because what that clinic does is a not-for-profit where we treat members of the community for free. And we've actually seen over 600 patients since its inception. So that's something we're very proud of, and it really gives students experience as well. So here is actually some of our additional facilities, some of our students, some of our staff here. And what you're seeing here is the standardized patient unit that I just mentioned, in addition to where the free clinic is actually located as well. I mentioned our on-campus accommodations, and just to kind of give you a glimpse, here are some of our dormitories here. We actually have around 7 to 8 dorm blocks here on campus. And so each dorm Of course, it varies by different options, but each dorm has, is fully air conditioned. Utilities are included, and it's everything is right next to the campus. And actually, let me go back for just one moment to the first page, to the aerial view of our campus. So here in the center with a dark roof, that's actually our primary administrative building. And then the surrounding buildings that you see to the right, for example, are actually our dormitories. So that is how close students are able to stay to the campus should they choose to live on campus. Let me go back to the last slide here. Here are some of our additional facilities. For example, some of our classrooms. This is our gym that you can see here, in addition to several student spaces. So what we also implemented recently there's a lot of study rooms where students can actually congregate in addition to the library. So students are able to use it. We have around 5 or 6 small group study rooms for students to be able to use. And it's just a different location for people to study, of course. Now on the final slide here, you actually can see our restaurant in the top left here. In addition to our restaurant, you have a little bit of a glimpse to our anatomy lab, which is here. You can see our library in this picture, in addition to our fitness room, in addition to another study area. So we're really proud to be the University of Health Sciences Antigua, because we've graduated thousands of students over the years. And I'm very particularly proud that our graduates are actually joining us today, and you'll be able to hear firsthand from them. So thank you for having us, and we look forward to welcoming students who are joining us today here in Antigua.
Well, thank you we thank you for being here, because giving out this information and the presentation that you just had, which was very much in detail. And it wasn't just telling us a little bit about the lifestyle, the education, the facilities, showing everything, I think kind of helped a lot of people that are online today and watching us and be able to see this, and giving them the information about the on-campus dormitories, which is very important, because a lot of our students ask us, the living costs and how much they will need to live in Antigua. And we, as here, we're kind of more Northern America. I'm from Chicago and Jane, Canada. We kind of say it Antigua, but it's the way Antigua. You're saying it, Antigua.
So we will make sure we say Antigua.
Antigua. I'm sorry, but did I hear you mention that you're from Chicago?
Yes, because Dr. Akande, I think you can tell by our accents that we're American.
Fantastic. I'm actually I was actually born in Chicago, and actually our founder, who's actually my father, my parents met in Chicago. So
actually,
Chicago is actually very
Dr.
dear to our hearts.
Yes, because I'm an advisor here at SME for many, many years. So when we have a new collaboration, I go and do a lot of research, and I did see that you had a lot of connections with Illinois in general. Yeah, so I've done a lot of research.
Wonderful.
So thank you so much for that. I think that it's very important, first of all, that the students and our British students that are with us today know that the University of Health and Science does meet the GMC qualifications, of course, because that is the most important thing for them, to be able to come and study there and know that they will be able to come back and have a degree that they will be able to register. I think that's the most important thing for them. And having doctors, of course, because we do know there are many, many UK graduates that are doctors working in the UK today. But like I said, the dormitories, I think that it's very good, Jane, because a lot of our students are asked us about this, and we weren't really sure about how many dorms are available, because there's probably a limit of students that you can accommodate, obviously. But it is good that we know that, can you just tell us approximately how many students can you accommodate in these dormitories?
Sure, of course. We can accommodate up to around 60 students on campus. Now,
Great.
yeah, in addition to just mentioning the dorms on campus, though, we also have designated off-campus housing, which is nearby to the campus as well. So
Perfect.
students
Perfect.
are in recommended areas,
Perfect.
recommended
Okay.
campuses, I should say.
That's perfect. Great.
Beautiful.
Thank you so much. I'm sure we'll get back to you later. So let's move on to Dr. Flores, which is the Provost and Vice President for Academic Affairs.
Hi, everybody. It's a pleasure to be here.
Hello. I was trying to get my information that I did my research about the accreditation, because I really wanted to know what this was. I finally found it. And I just wanted you to know that I do know what all this means.
Yeah, we use all these abbreviations in order, because the names are so long that sometimes you can't. But
Yeah.
you know,
I
you
just
can't
wanted you to know that I
right.
did my homework, though, and I do know what all this means, and it's very, very important. So it's not just abbreviating something, it's very, the meaning behind all this is very important. So we'd like to so you can give us some information about the UK pathway, and just give us all your insight on this and the program, the outline of the program, the 3 to 4 year program. I think everybody is just waiting to hear all the info from you.
Again, if I can share my screen.
Yes, of course.
And you should be able to see my screen now.
Yes,
perfect.
of course.
Give me 1 second. All righty. So the University of Health Sciences of Antigua. Our motto is, one of our mottos is together we discover, learn, and heal. Okay. Here again, you see the picture of our campus that Dr. Akande described a few minutes earlier, sorry. Okay. So again, as Dr. Akande said, we have a standard 4-year medical program. It can be shortened if you do everything back to back, okay? The first 2 years are dedicated to what we call the basic sciences. And those are the building blocks. We teach things like anatomy, physiology, pathology, pharmacology. Not only that, we also teach about human behavior. We teach about medical ethics and law. We teach a lot of things. And if you want to volunteer, you can join our free clinic during those 2 years and learn how to manage, the clinical environment. After you're done, and I'm gonna get more into this in a few minutes. Okay. After you're done with your basic sciences, then you move to the next level, which are the clinical sciences. And the clinical sciences, basically what you're going to do is you're going to learn by being exposed to real patients, of course, under the direction of medical faculty. We call them attendings here in the United States. And you do that in our affiliated hospitals, either in the United States, we have affiliated hospitals in Canada, in Puerto Rico, Nigeria, the UK. Okay, so you can do that basically anywhere you want. The UK pathway is designed only for students that want to practice medicine in the European Union, the United Kingdom, and Australia. Okay, and it meets all the GMC and the European Union requirements. However, it is not designed for students that want to practice in the USA or even Canada. Okay, Because here in the United States or Canada, you have to pass the US medical licensing examination or the Canadian licensing examination, and you have to take another course that we call the review of basic sciences, because you have to pass USMLE step 1 before you continue into clinical sciences. So I want to be very emphatic that this UK pathway is designed for students that want to practice medicine in Europe or even Australia. So as I said before, the basic sciences are the building blocks of medicine, okay? And we will prepare you to learn all the things that are needed in order for you to have contact with patients. But very important, you see here a picture of our standardized patient unit, because we don't forget that you want to become doctors. You don't want, this is something that I always say, you don't want to become anatomists or physiologists or pharmacologists. You want to become medical practitioners. You want to become doctors. So in order to do that, we pair all these subjects with what is important in your medical practice. And we do that through several tools that we use. For example, in the classroom, because doctors are problem solvers, we don't teach you medicine in the traditional way of a teacher in front of everybody, just talking, and you're there just hearing what that professor wants to say. In the way we teach it is, you are the basic, you're the learner, so it's centered on you. So because you're going to become a problem solver, you're going to learn through problem solving. Okay, so that's basically what we do. The other thing that we do is, you see here the standardized patient, and a standardized patient is a regular person that has been trained to portray an illness in a standardized way. So we can teach you how to interact with that patient. We can teach you how to diagnose that patient. We can teach you how to create a plan for the treatment and the management of that particular patient. I prefer to use management, the treatment, because it's more comprehensive. And we can teach you how to be emphatic with the patient, the proper words that you can use in order so the patient can feel close to you and disclose everything that they are suffering at that particular point. So, and the other thing that you do is also, you go to the hospital, you go to Mount St. John's Hospital, and you will shadow a doctor. And this isn't from year 1, okay? This is not, you don't have to wait until year 3 or year 4 of your career in order to start seeing patients. You start seeing patients from year 1 of your medical school, either through standardized patients or real patients in the a hospital, okay? This is the basic sciences curriculum. And now, let me tell you, it's what we call an integrated curriculum, because we have divided the basic sciences in 2 parts: human engineering and disruption, repair, and care. And human engineering 1, 2, and 3, as you can see here, they're taught in academic sessions, MD1, MD2, and MD3. These are trimesters. And human engineering 1 is a combination, is an integration of clinical anatomy, embryology, and histology. Human engineering 2, which is taught in MD2, is an integration of biochemistry, physiology, and genetics. What I mean by integration is that we teach everything at the same time, so you understand it better, and you can correlate it clinically to the patients that you're going to see in the future. And human engineering 2, which is taught in the 3rd academic session, is a combination of neuroscience, medical microbiology, and immunology. Then, added to those, in the MD1, you will have a course that is called the Physician and Society. That is an integration of medical professionalism and medical history. In the second session, you will have perspectives of the mind, which is behavior, human behavior. And in the third trimester, you will get healthy communities, which deals with health, wellness, and prevention. I'm going to get into the practice of medicine at the end. In the fourth and fifth trimesters, MD4 and MD5, then you go into disruption, repair, and care, 1 and 2, which are a combination and integration of pathology and pharmacology going by organ systems. So cardiovascular system, pulmonary system, integumentary system, which is the skin, nervous system. And we're going to be going through those, teaching you about the pathology and the pharmacology of every organ system. And we teach you the physician as a scientist, which is basically research. We teach you how to do research in that course. And the medical ethos, which is, as I said at the beginning, law and ethics, medical law and medical ethics. Now let's go into the part of here that I haven't talked about, which is the practice of medicine. We have 5 courses of the practice of medicine. Practice of medicine 1, 2, 3, 4, and 5, and they go from MD in each and every trimester, MD1, MD2, MD3, MD4, and MD5. And in these courses, we teach you clinical skills for the first 3 trimesters, meaning how to do a proper physical examination and how to obtain a proper history from a patient. And these are done through our standardized patients. So you're going to learn and practice with our standardized patients. But you also go into the clinical observership, so you see how a doctor in a real clinical environment does it. And that's from 1 to 3. Now, 4 and 5 are clinical diagnosis, because now you know how to obtain a history, how to perform a physical examination. Now you're going to learn how to diagnose and treat those patients, because these courses are coordinated with disruption, repair, and care 1 and 2. So if they're teaching cardiovascular system in the disruption, repair, and care, you're going to go into the practice of medicine 4, and you're going to, after you learn about cardiovascular here in disruption, repair, and care, you're going to learn how to apply it to a patient in the practice of medicine 4. So they're coordinated in order for you to understand medicine and apply medicine, which is the most important part. After you're done with that, then you go into your core clerkships. In the core clerkships, you have 6 core clerkships, and you will do 12 weeks of internal medicine, 12 weeks of general surgery, 6 weeks of OBGYN, 6 weeks of pediatrics, 6 weeks of psychiatry, and 6 weeks of family practice, for a total of 48 weeks in your core clerkships. Then you go into your elective clerkships. Now, your elective clerkships, as the word says, you select. You say, well, I'm very interested in pediatrics. I want to do most of my electives in pediatric subspecialties, or even doing pediatrics junior internship. Okay, and I'm very interested in internal medicine, so I'm going to do a lot of subspecialties of internal medicine, such as cardiology, gastroenterology, things like that. Okay, and I listed here just some of them. Okay, but the most important thing is the last phrase here, and many more, because the sky's the limit when it comes to elective clerkships. You may talk when you're doing your core clerkships in pediatrics, and you meet a pediatric cardiologist, and you say, well, Dr. So-and-so, can I do my elective with you? And the only thing that you have to do is you communicate that desire to our clinical department. We get the curriculum vitae of that particular doctor. I signed off on it, and then you can start doing your clerkship with that particular doctor. Now, affiliated hospitals and clinical centers. In Antigua and Barbuda, this is a beautiful picture of Mount St. John's, which is the main hospital on the island. And this is a hospital where you will be doing your observerships, okay? But we also have an affiliation with them. So if after 2 years you decide that you want to stay in Antigua and do your clinical rotations in Antigua, this will be the hospital where you will be doing your rotations. We also have an affiliation. This hospital does not have psychiatry rotations. So we do have an affiliation with Crossroads Center in Antigua, which is the psychiatric hospital in Antigua. So you will be doing your rotations, most of your co-rotations here, but your psychiatric rotations would be done in Crossroads in Antigua and in the Belmont Healthcare Center. Also, in Canada, we have a big hospital at the Labrador-Grenville Regional Health Authority. Okay, we are, I think, the only medical school in the Caribbean that has an affiliation with a hospital in Canada, because they're usually affiliated with Canadian universities. Okay, and the Labrador-Grenville Regional Health Authority, they operate 22 facilities, including 3 hospitals, 3 community health centers, 14 community clinics, 2 long-term care facilities, and its headquarters are based in Happy Valley Goose Bay, and they serve approximately 37,000 people. In the United Kingdom, we also have rotations, okay, in some UK hospitals and what the GP surgeries. So if you want to, you can go back home or near home and do your rotations in the UK. In the United States, we have most of our rotations are in Illinois, okay? We have the Community First Medical Center in Chicago, the Loretto Hospital in Chicago, Oak Park Urgent Care Center, and the Wise Memorial Hospital in Chicago. We also have, I didn't put them here, but we also have rotations, clinical rotations in Puerto Rico, which is an island in the Caribbean that is part of the United States. So all the hospitals there have to go through the same process of accreditation as any hospital in the United States, but those hospitals require for you to speak Spanish, okay? Perfect. So one of the most important things that we get asked all the time by students from the UK is that if we meet the GMC requirements, and we do. Especially the question that we get asked all the time is contact hours, because the GMC requires 5,500 contact hours when you're in medical school. And our MD program has 6,345 hours. So we cover all the requirements, including the hour requirement. As you can see, we surpass it by almost 1,000 hours. So you will not have any problem whatsoever in practice medicine later on in the UK. So now, some important additional information. And I'm not sure if this is correct, but the program is offered to you. I always say that I only deal with academics. I usually don't deal with money in the university, but the program is offered to you as a discounted package. Okay, we have 3 intakes for year, so 1 per trimester. The program is for a year. It's a 4-year program, but you can do it in 3.2 years if you do all your rotations without breaks and all your medical education without breaks between trimesters, and you don't take any time between your medical rotations. And as I said before, you can have your rotations in UK hospitals and GP surgeries. I think I'm done with my presentation. It has been a pleasure to be able to talk to you.
Thank you
And,
so much.
Very
I think,
informative.
yes, very
Very.
informative. And it's very, very important. And I think our prospective students, the parents, everyone with us today has received so much information that I think that in the end, it's easier for them to make their
their choice.
decision because they feel that you have given them an outline of the program that they will be doing, regardless if somebody chooses to do 3.2 or 4 years, it doesn't matter. You've given them so much information and important information on how the whole structure of the program is, the preclinicals, the clinicals, the basic science courses. Very important where you said that these students go in and are shadowing doctors from the first year of their clinical science program, which is very important. And of course,
The free clinic, I really like that, the free
the free
clinic.
clinic, yes, that they do. And of course that the program for our British students, which is, I think, the most important of all, is that you have a program that is not over 5,500 hours, actually almost 6,500 hours, which is, I think, the most important thing for our British students to know that they can study in Antigua. We're getting better, a little bit better, and be able to come back as all the students, as we'll have our doctors just coming up shortly talking about their experience. And of course, pointing out, like you said, you don't want to get too much into the money, but we do know that our students have that exclusive offer of only $8,500 per year that they pay. So, and Jane, do you have any other question you'd like to ask? I mean, of course, the amazing collaborations with the hospitals in Canada, in the US, in Chicago, and of course, in the UK. UK hospitals, UK rotations in hospitals and in GP surgeries where our British students can do some of their clinical rotations here. So I think everything we've said about everything, right? Yeah.
I just want to say that it was very informative and thank you very much for having so much detail that it actually, I think that I don't think there's any questions really. Not even
No,
from
I
the
think
parents.
I think you've
the
asked,
parents
you've
did everything, you
actually
answered everything for us.
Dr. Forrest, you've answered every question we could ask in detail, I would say. So thank you very much
And
for
thank
that.
you for the presentation. Too.
Yes.
Thank you.
And of course, our next speaker is Ms. Lizette Roman, Vice President of Institutional Investment, and she will be giving us information and all the insight on GMC recognition of the University of Health and Science. We'd like to welcome you with us today.
Thank you so much.
Hi, how are you?
I'm doing great. Thank you for this opportunity.
Oh, thank you for this opportunity, actually. All the information that has been given to us today is so, this is what we're saying, it's so much information that our guests today, I think, is going to, their decision is going to be easily made.
I just want to say before I begin, for me, the UK is very near from my heart. In my experience in the school, I've been in the school for 16 years. The great majority of the UHSA graduates practicing in the UK were students that I saw when they were between 17 or 18 years of age. Yeah. So it was beautiful to see this enormous and fantastic transformation, seeing them come as students of our university and become these great physicians that are currently now practicing in the UK.
Yes, I can imagine, especially because you knew them from the beginning and where they are today. Yes.
My name, for the ones of you, obviously you don't know me, but my students do. My name is Lizette Roman. I'm the Vice Provost of Institutional Advancement and International Affairs. I've been working for UHSA for 16 years. My work has been mostly developing and the school, the relationships between institutions and also hospitals between some other things that I do. Oh, so sorry.
That's okay.
The General Medical Council is the organization that does and oversees the process of accreditation and also the approval of institutions, international institutions. The GMC recognizes the UHSA School of Medicine since 2014. Our institution meets the requirements of the GMC that we are registered in the World Directory of Medical Schools. And Dr. Flores, as he mentioned recently, our medical program complies with the 5,500 hours required by the GMC. In the registration process, when the time comes for this, you have been already graduated from our medical program. You will create an online account with the GMC. The uploading of the transcript and the diploma is done. You pay the fees for your exam, and then they will contact you to let you know when this exam will take place. The PLAB, which was the exam as we used to know it, is going to change. The MLA is now being named, also known, widely referred as the UK MLA, is a new medical exam introduced by the General Medical Council, in which every student graduating in the academic year 2024 and 25 will have to pass. International students who want to practice in the UK and who currently took the PLAB will need to have approved the exam from 2024. Changes have been done, but don't get scared. It's very similar as the PLAB. But it has two parts as a PLAB as well. This is a small list of our graduates. You're gonna hear very soon from Dr. Manu Nair and Dr. Chinedu Ikimoris. We have also Dr. Sabrina Memarian and Dr. Lara Tyne Alsadoun. As I said, for me, these students are like my children because, you know, I managed to know them and to even fly with them sometimes from the UK to Antigua. And for me, to see them being transformed as the professionals that they are, fills me with a lot of joy and pride. For the students interested to know more information about the policies of the university as a student manual, clinical manual, and the UHSA catalog, you can visit our website, which is www.uhsa.ag to download the information. It's a small presentation. Thank you so much for the opportunity. UHSA has a mission to continue to develop medical students to become physicians, to try to go ahead and make this world a better place where to live, healthcare-wise. And I just want to thank you for this opportunity.
Thank you so much. And on that note, this is how I started off my presentation, was that medicine is only for those who can't imagine doing anything else in their life.
Yes.
Just to be doctors.
Correct.
And I don't believe that anyone can be a doctor. It has to come in from deep inside. You have to feel it and you have to want it. So these people that are with us today, and for so many years, we see students, and some of them say, well, I don't know if I meet the qualifications. And I always tell them that it's not always if you are a straight A student.
Correct.
I've seen students who are with B's and C's and they got into medical school, but they wanted it so with passion that they're great doctors today.
Correct. That is so true. And these two students these two graduates who were talked to you now
Yes.
are examples, very great examples of the determination and discipline they have been since the very first beginning that they started with us. They did their work with such passion, and they were so serious about it that their sacrifices paid off, and today they're wonderful doctors.
Thank you.
Thank
Thank
you.
you so much.
Thank you very much.
And as you said, GMC recognizes, of course,
Yes.
University of Health in Antigua. There's many, many graduates, which is one of the most important questions that our guests today have, and mostly the British students, is they want to make sure that the university and all our partner universities meet the GMC qualifications, of course. And we'd like to thank you on that. A great presentation, a lot of information. Thank you. I think all of the representatives of a University of Health and Science took all our work and you did it for us. Actually presenting all this information, the amazing slides and program. Thank you all so much. So we will now, of course, introduce our doctors, our graduates from University of Health and Science. Our first doctor with us is Dr. Morris, from a UK graduate who has, of course, 5 years of experience and working in the NHS as a junior doctor. Good evening, doctor.
Good evening. Thanks for having me.
Good evening. Thank you for being here today and being able to share with us your experience, because as a doctor now, but if you think back when you started, I think that you would have loved to have someone being able to have a presentation like this to just tell you how it will be where you are going to go. So I think it's, thank you for being here.
Yes, it's a pleasure. Like you said, it would have been great to have someone like ourselves, answer questions when we wanted to join the university. But we had Miss Roman then, and she was amazing. She did a fantastic job. She had brochures. She answered all our questions, at an instant. So she was amazing, and she's still amazing. And I just want to say thank you to Dr. Flores and Dr. Kande for having us. Pleasure seeing all of you again.
I think they're very proud of you. Miss Roman said that she was the best words for you, and of course for Dr. Nair, that she's very, very proud.
So are you guys having any questions you'd like us to answer?
Well, basically we wanted to just have you a little bit tell us about your experience there, of the program, of the living there, that if coming back to the UK, did you feel at all that your degree was any less than discriminated in any way than any UK doctor who had a degree from here? Because I think with the percentage of doctors in the UK with degrees of course from abroad, I think everyone is equal. Did you at all just give us a little bit of information on studying abroad in Antigua, and if it was just an easy transition coming back here?
Well, studying in Antigua was a very wonderful experience for my part, because I got innovative medical education. The university was always ahead of its time in terms of constantly revising the curriculum to try and meet with the modern time doctor medical education, and in terms of the degree being looked down on in the UK or elsewhere, I think it all depends on the medical student or the clinician that comes out of the university. I've worked alongside people who've finished from Ivy League universities or Russell Group universities, like as you would call them in the UK, and you couldn't tell the difference between myself and them. It just has to do with your work ethic, actually paying attention to everything you're taught at university, because it all comes back again to help you practice safely and effectively.
Okay, where did you do your UK? I think, Jane, should we bring Dr.
both.
Nair also?
Yes.
Can we welcome Dr. Nair with us also? Hello?
Oh, yes. Hi. Thank you for having me.
Hi, thank you for being here. I think it's better if we have both of you here so we can give you ask you our questions and kind of share your experiences. Thank you for being here again with us. And as I was saying to Dr. Morris, that Miss Roman from Antigua, she was just telling us how proud she was of you and of course all the graduates, but especially both of you guys. So thank you for being here. We just wanted to ask a few questions just to have a little bit of information. Dr. Morris told us a little bit about coming back and a little bit of the experience of studying abroad. Can you, both of you, of course, tell us a little bit of where you did your rotations, your clinical rotations?
Yeah, shall I take that, Morris? So I was quite fortunate. I was able to do my clinical rotations, majority of them in the UK, as part of Whipps Cross University Hospital. It's part of the Barts Health Trust. That's one of the largest trusts in the UK. They've got about 5 hospitals that span across. So I did most of my cores and majority of my electives at that trust in the UK. Teaching was amazing. You're basically treated as an equal to other medical students. I was rubbing shoulders with students from Oxford, Queen Mary University, and you're always treated with respect, even though you're a Caribbean medical student. They never really saw it that way. You would partake in the same OSCEs, in the same patient bedside teachings. And it was very excellent, great experience.
Okay, and Dr. Morris, did you do your clinical rotations here also?
Yes, I did my clinical rotations in the UK as well. I did mine at a couple of sites actually. I did a few of them in Epsom General Hospital and then St. Helier, and then I did the psychiatry at a different trust, Surrey and Borders. And yes, it was a very rich experience because, like Manny was saying, I got to attend ward rounds and clinics with students from other universities around the UK or locally to the hospitals, like St. George's, for instance. And in the morning, I'd rock up to the ward. I'd join into the medical team or the surgical team, and we'd do a ward round. I'd get wards or bedside teaching, and then middle of the day, I would also get dedicated teaching from the clinical fellow at the postgraduate center, and then go back to the ward in the afternoon and carry on learning, then finish off with some studying later on at night. Yeah, it was a very packed day, but it was very rewarding.
Great. We know that obviously when you were studying in Antigua, the tuition fees, of course, were completely different. We know that the exclusive offer that the SME students have now are only $8,500 per year. Can you just tell us approximately how much you were paying then?
I think for the entire period of my study, approximately about £100,000.
£100,000, exactly. We know that these are the fees in general in the Caribbean, in different universities, of course. And this is why this is such an exclusive offer from SME and for our SME students. So you can imagine somebody thinking now, Dr. Morris, that somebody's going to be paying only $8,500 per year. It's quite amazing. It's quite amazing.
I have a question.
Yeah.
Usually we ask females, but we have males here. I'd like to just ask about the university city itself, the safety, the nightlife what there is around there for someone to do. It's very important because a lot of the parents always ask us, even though usually the students are going to be a little bit older because they have bachelor's degrees, it's still always nice to know. Coming from Canada and from the US, we don't have a problem. We know the islands very well, but it would be good for someone which is from the UK to be able to tell us how they found the lifestyle and the safety in the island itself.
Yes. Do you want Dr. Nair to reply?
Anyone who would like to reply?
Yes, yeah, I can understand. My parents also had those apprehensions when I was, starting my journey at UHSA, but I can definitely vouch it was very safe. Lizette was like family, and if you had any issues, she would always be there to help. And so the other professors, there is that more of a, it goes beyond a student-professor relationship sometimes, and they do understand you've flown thousands of miles away from the UK to be here, and so they do appreciate that, and they do take their time to have any concerns. That they're always happy to help. As a student, of course, being on such a beautiful Caribbean island, you see the photos, clear blue waters, white sand beaches. That is exactly what it is. It is an amazing.
Yeah, that's what we're saying. That it's like studying on the beach. It's you think about these islands and you just smile.
Yeah, I mean, I still get when I'm talking to colleagues and they realize, oh, you study in the Caribbean. They're always so jealous. Like, oh, we've had to study in cold, wet, windy, and you managed to study in beautiful sunshine. But it's still hard. It's intense. You've got examinations and assessments. We're finding I was studying, every day till late because the curriculum is very intense, and to be a doctor it's not easy. So I appreciate that is how it is. Locals are very chatty, friendly. I've still got friendships with locals in Antigua. You create bonds when you're there because you're so far away from family and friends. Your classmates and your professors, you sort of create a very close-knit family type, feeling while you're there, and that does help you progress through the assessments and examinations and tests that you have. Nightlife, we're quite fortunate that we've got English Harbour quite next door to the campus. So if you did need to relax and let your hair down, there is. I know some students, they are known to have, they want to, after having studied so hard for an exam, they want to let their hair down. We're quite fortunate. We've got English Harbour quite close by, where there are a lot of nightlife activities. But yeah, I mean, in general, it was pretty much a very amazing experience.
Okay, great.
I have one more question, which is usually very, we've got a university that's an international university, which is also multinational, which means that a lot of students always ask, or parents and students ask us, is it easy for multinational, different multicultural people to be able to find food that they need, like halal, kosher? Okay, if us McDonald's, anything like that?
Yes, yeah. So we've got there's a lot of shops. The main one being Epicurean, was one of the big supermarkets in Antigua, and we would frequent there quite often. They've got everything you need to buy. They've got halal meats available as well. They've got a mosque on the island as well. I know we had a lot of during Ramadan. There was students there would be prayer groups that in the evenings to open their fast together. So yeah, and there's groups that would go to church on the Sunday or the Saturday. So they are very open and inclusive for all faiths, all religions at the university and on the island as well. We've never really experienced any. I know some sort of coming from Asian background, you might be worried about a bit of racism, but no, there was none of that. I've not really experienced any of that sort of racism at all. It was very, very open-minded, very inclusive. I'm sure Maurice would agree. Life was
100%. Was a very inclusive island, very beautiful place and peaceful as well.
Great,
Oh, perfect.
great.
Good.
Thank you so much. Thank you, each and every one of you. we thank you so much for this whole presentation about the university, about the island, about the facilities. Dr. Akande, thank you so much for being able to basically provide this option to our students from all over Europe, from the UK, from Australia, and this exclusive offer. Thank you so much, Dr. Porvis, for being able to give us an outline of the program and tell us exactly what a student will be able to do and the program and how it is done. I think it was very important. And of course, Ms. Roman, thank you, because I think your part was a little bit more emotional
part.
which that kind of gets to everyone's heart.
Of course.
And of course, the doctors that are with us today, thank you so much. Thank you for being here and sharing your experience. We know that the future doctors wanted to hear from you firsthand exactly
Correct.
the steps that you took and everything that was needed for someone to know that they can come back and that this degree is equal. I don't know if any of you, because I've seen you pop up, maybe you want to say something, but we definitely want to thank you for being and making this amazing
Beautiful
presentation.
presentation.
Been a privilege.
It was
I
absolute
opportunity to
pleasure.
meet with all of you.
It was amazing, and thank you so much to our two UHSA graduates. I want to thank you personally on behalf of my school for making us so proud. And all of you who are watching this presentation, we are a school that has dedicated since 1982 all of our courses, all of our knowledge, all of our experience in order to offer you the best medical education possible. Thank you so much, and I hope to see all of you soon at the university.
Absolutely. And I just
Dr.
want,
Akande?
yeah, I just wanted to just add to what Miss Roman was saying. And I know she had mentioned how, you know, she's watched our graduates start with us when they were very young. And I just really can't stress enough that we always say that UHSA is our students are like family, because I mean, that's basically what our students become, because we're connected to our students for the rest of their career. I mean, we're still to this day, when we have graduates who we've had to continue to even, you know, write recommendations for, who have graduated in the 1980s. So when students come to UHSA, you know, it's more than just coming to medical school and becoming a physician. It's more than that. You know, we get to, we know each other, we become friends, we become family. And so I just want to say that, because I just can't stress that enough. And I mean, as far as the safety of the island, for example, I mean, even I reside on the campus. So my primary residence is on the campus. So, and I can vouch that, you know, we are one of the safest islands in the Caribbean, and we're a very secure location. So I just wanted to add that, and because I know there's a lot of parents that are watching this and will have those types of questions. So I just wanted to make sure that's properly communicated. So, but yeah, thank you so much for having us. And I can't thank our graduates enough for having for joining us today as well.
Thank you.
Thank
Thank
you
you
very
so
much.
much.
Thank
Thank you
you.
for an amazing presentation. Thank you.
Thank you.
Thank you.
Thank you. Have a great weekend,
Nice
everybody.
afternoon. Bye-bye.
Bye-bye. Have a good
Bye-bye.
afternoon.